Yes.
Okay.
We'll I will take a we'll skip the prayer, etc. We'll uh, present the slide and then 15, 20 minutes, then you will present and then we'll have a discussion.
Sure, Sachin. No issue.
રિદ્ધિ બધાને આપણે લિંક તો છેલ્લે બધી ફરી મોકલી દીધી છે ને? Those who have registered, we have already sent them a Zoom link.
Okay.
Although it's open, at least reminded link was given to them.
Okay.
રિદ્ધિ એક્સેસ બધાને આપી દીધો છે? હેલો 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 હા હા બોલો. So, Asasji, I'm starting the sharing the slides, and we are recording this so that we can share it later on to the people.
Sure.
And around 50 people have shown the interest. But anyway, whosoever has joined, we'll start with a presentation. I think the presentation is visible.
Yes, it's visible. But maybe give another 2, 3 minutes just for this to properly join.
Okay. Okay, few people are watching live on YouTube, no problem. So I think instead of waiting, let us start with this because the rest of the people can watch the videos later on. Uh, Now, we are starting the introductory session on virtual medical education, and the whole program is conducted by Human Health Circle. And the Human Health Circle is basically integration of various system of healthcare system, and modern medicine is in the center, what we call allopathy. And the uh, basic purpose, it is to utilize knowledge of best faculties and doctors of the world, and with seekers of the health knowledge, we would like to share this knowledge and skills also. And we feel that ultimately, once the students, doctors, and volunteers are empowered with the knowledge and skill, then it will be beneficial for health and medical care all over the world. So it's not that we are restricting ourselves only to the India, only to one region. So it's globally open for uh, understanding, getting education, learning, sharing, etc. And the purpose would be it will be evidence based, integrated, and best knowledge and skill uh, should reach to the people all over the world. And the purpose is internal peace and happiness with overall holistic health, which includes physical, mental, and social health. સર એ તો મેં હજુ સ્ટાર્ટ કર્યું છે એટલે તો તમને કદાચ વચ્ચે બોલવું હોય તો એટલા માટે ફોન કર્યો. આવવાનું સર. Now, what is to be kept in center in discussion and dialogue? These are the points. The whatever educational activities we are doing, committee and patients are in the center, and for their welfare and their good cause, we are starting this program. And
है क्या
and the students who will be learning under this platform will get a best education provided we give enough emphasis to the faculties who are going to teach. So faculty selection and student selection will be done with a special selection team. And students should be able to treat the patient, prevent, etc. But they should be well prepared for university exam, for some time PG NEET, and next examination also. We should keep the future of students in mind. Now, students are sometimes puzzled that which branch I should take, what kind of whether I should go for IAS, etc., etc. So that will be having a discussion, and research and innovation will also be one of the cornerstone of this whole education process. While we learn the moral values and the purpose of life should be inculcated so that we can go in the right direction. Now, the points which we are going to discuss over a period of time, the various committees will be there for various topics because we expect that at least 10,000 students will join this education system, and then maybe a few more will join later on. So to handle this 10,000 students, we'll have the various advisory and coordination committees, department-wise type. Right now, there will be around 20 departments initially, but then it will grow as we enter into the super specialty also. And it will not be only a courses like MBBS, first year, second year, like that. In addition to that, various courses will also be there. For example, epidemiology or maternal health, child health, like that. And short courses will also be there. Suppose someone is an ENT specialist, but wants to learn something about nutrition, then a short courses will also be there. And online platform for learning and teaching, which we have already prepared, that is should be tested. There should be a dedicated IT team, because the virtual platform, there will be lots of input required from them. Then we'll have a special evaluation examination system. Only examination will not do. Evaluation in a situation where the future student is going to be working. So we will have a special virtual platform for evaluating the students. And the students will be not only categorized as per the curriculums, but also the modalities of the or mood of the students. Few students would like to have a lectures, few students would like to have a live interaction, other students would like to have a flow charts, etc. So according to their the likings and according to their aptitude, we may change in a curriculum, or we may change in the method of teaching, etc. And for them, there will be a different kinds of schedule will be prepared, and it will be fitting to the teachers or faculty's time also. Then mechanism for advances in research, because the NMC also now emphasizes in community health research, etc. So we'll have the special application will be invited for the research proposals, grants, etc. for the students. The global interaction for the telemedicine will be platform will be available. Although right now 700 faculties have joined, but we forecast that once we have around 10,000 students, we'll have more than 2,000 faculties with us. And 1 faculty to 5 students, or 1 faculty to 10 students, hand holding, etc., can also be taken place. It's not that virtual that one person is talking and thousands of people are listening. It will not be like that. There will be group interactions also uh, in this system. The online health record system and with a full confidentiality will help us. We envisage that more than 10 to 50 in lakh initially records will have, and then probably 10 to 20,000 records will be there every day in our system, so that research becomes a left-hand job, and it will be handled with AI and good analytic system, so that which medicine works, which doesn't work on the common platform for the whole global, that will give a lot of the value to the statement, to the education, etc. We need to also discuss about legal aspect. Initially, we wanted to use the word virtual medical college, but the college word may lead to some problem, legal problems. So we removed that word, and now we are using the word virtual medical education. Now, recent research says that 50% of the Indian population are using Ayush, Ayurveda, or homeopathy, or naturopathy. So when
Yes,
a
Jonathan.
50% when a 50% population is using this kind of alternative system, then medical students have at least some basic idea about what does it mean. It is also affecting the life of the people positively or negatively. But as a medical student, as a doctor, one should have basic knowledge of Ayurveda, homeopathy, etc. And that very short courses will also be offered. Other thing is health measurement and impact of a system of healthcare. Um, if I say that there is a blood pressure measurement, temperature measurement, etc., available, then why not health measurement? So we'll have a special system whereby you can evaluate the health of the individual and find out whether the health is increasing or not. Similarly, we'll have a input evaluation, that lifestyle scoring, whether the what is the level of the lifestyle of the person, whether is healthy or not, that will also be evaluated, and the effect of lifestyle on healthcare. Once we envisage that, once the student passes through the same system, first year, second year, third year, in the medical educational system also. In future, they should be remain united as a teamwork, as alumni association and parents association will be there from beginning also. And other points, these points are to be discussed over a period of time because we have a group of WhatsApp group are there, and then smaller groups will be there for the purpose of discussion. And we don't have only the virtual medical education, we have other Ayurveda homeopathy education system also under the human health circle. We feel that parents should be part and parcel of the education system. So, students' attendance and performance in virtual medical education, access will be given to the parents also or some other guardian also. Then few softwares will be shared with our medical students as they go on through our health education system. Let's say nutrition software, then advanced nutrition from day one, or let's say even after 1 week or 2 weeks, students should be able to analyze their own diet. Healthcare of the students and healthcare of the faculty will be one of the prime importance thing because then only they can lead a healthy lifestyle and then have a role model for the community. Then personality. Some of the students once enter into the medical college, they suffer from the depression, anxiety, etc., mood disorders. To know that, we'll have such kind of screening system also for medical students. Then we'll have a virtual hospital management system. Access will be given to a particular students, doctors, etc. And the telemedicine will also be there. And the student will not have the dearth of a number of patients. Here right now, in few private medical colleges, when students are learning, there are 150 students and patients are only 5. How they will are going to learn? So we'll have thousands of students simulated as well as actual patients available for them. And we are going to interlink our students with the voluntary organizations, government organizations, existing medical colleges so that practical and skill development will also be possible. This family health record system will make a revolution because not only patient record, we want to give a record of the healthy people also and as a family. So that if a father is suffering from tuberculosis and child is coming to you for the malnutrition, you can interlink that. If a grandparent is suffering from depression and now the child is suffering from depression, that could be familial relationship or familial transmission, genetic component could be there. So thousands of records will be there in our family record system so that family themselves can edit, update their data. They can know their health status. They know how to remain healthy, etc. And this application app will be useful for the region area-wise, subject-wise access, organized access. Suppose students want to learn more about the nephrology. And if the student chooses the nephrology, then student will get that messages only. So it's the area-wise organizations, the messages can be availed. And also there are various ebooks, videos, link, etc. available in which they will be able to learn themselves also. And so there will be app-based learning as well as web-based learning. And this learning platform we have prepared, and that is under the testing, in which the HSA education software gives a lot of the leverage for students to learn, teachers to keep education. There will be quizzes, there will be the evaluation, and at the end of the course, certification will also be there. And this automation is done to cover large number of the students. There will be various category, person can choose MBBS course, epidemiology course, etc. And it can progress. You can join as a student or you can join as an instructor. We feel that our all students will be instructor in future. For example, first semester student pass, enter into the second MBS, that student can become instructor for the next generation first MBS students. And sometimes student to student learning may be a better. Evaluation will be there for each and every instructor so that we can know that the education is going the right direction or not. There is something like, because our own virtual medical education itself, that will have also a software, because two students are writing a journal article, there is some workshop, there is something like project development, all this will be governed by the management software. And this is a small example I will skip very fast. Will not enter into the medical education will after first MBBS. As soon as the student has passed 12th standard, they are seeking to enter into the first MBBS or even first Ayurveda year. We'll have a pre-medical bridge course, which will invest their time for a better tomorrow. So when they come to the first MBBS, they know something about anatomy, physiology, etc. And this is a whole about the any system they want to enter, nursing, pharmacy, physiotherapy. But once they enter, complete the 12th standard, they are they are invited to join this bridge course. And the bridge course will contain a lot of subjects, a small introduction of each everything, which includes the information technology, research, English, statistics, etc. Personality development, how to learn, how to interact with the seniors, all this will be there. And now, before we start discussion, I will request the mastermind Ashish ji to present something about virtual reality, because virtual medical education will be aided by virtual reality, so that hands-on training can also be there. So I stop sharing over here, and
Yeah,
I request Ashish ji to take over.
sure. Thank you, Dr. Mehta. Let me continue on this. Hello, everyone. My name is Ashish Margudri. I am the CEO and founder of Inyon BI Technologies. So let me share the screen. Yeah. Yeah. So our company Inyon VR is basically a medical education platform which guides through virtual reality and augmented reality. Currently, we provide virtual reality-based surgery simulations and training to medical colleges where it's implemented in their labs, technical skill labs, where students perform along with the mannequins and etc. And that's how we provide our training system. Now, as we move further, as we know the problems that are currently faced in the education system, basically, let's say even in the 4-year MBBS or any period of medical education, we have PPTs, we have YouTube videos, we have if we are not able to properly see, the doctors are not able to properly see the surgeries going on and etc. Right? So to counter that, we brought this educational system where you use the virtual reality headset, such as these, and are able to perform the complete surgery or even learn complete about anatomy, radiology, pathology, etc. in a 3D format. I'll show you soon. That is what a dynamic interaction is, where you use your own hands and in your current room or anywhere you are, you get a 3D model in front of you, just like a cadaver. Then comes multi-person classroom. In multi-person classroom, basically, let's say I am wearing a headset. There are other 5, 6 students wearing headset, or 100 students are wearing headset. All together can come on the same platform, and they'll be able to see the anatomy that you're trying to teach them, rather than the PPT based, text based learning. And performance tracking is where students are given task questions, or as they go further with the surgeries, learning, and etc. They are we have implemented AI in which they are tasked according to the timing and the accuracy of the surgeries, and as they move further with it. Now, this is what we are trying to implement in the medical education ecosystem. We have started with a guided VR surgery, as I'll show you soon. and AI-based evaluation method for students. Then going to live VR class as we are implementing with Dr. Mehta in the HSC, where it was doctors current in the initial phase where doctors, the tutors basically will be using the VR headset to present it to the students on the Zoom call or on the Google Meet call, and are able to teach them completely in a 3D format, and then going to live VR surgery and etc. Now, this is one of our product review video from one of the college students. In this, please take a look. I hope the audio is audible.
We can't hear the audio.
Okay, okay. So basically, he's wearing a headset over here, and we have a virtual surgery room over here, in which he's performing a lipoma-based excision, and then he is guided through each and every tools that needs to be used, and using the controllers and the headset, he is able to perform the complete surgery. Cutting and etc. Each and every part can be simulated in the virtual reality. And this is for the syllabus-based pass-through. So this is the currently live room. This is a live room. And in this live room, we have implemented a 3D model of anatomy. There are different, anything you want to select, skeleton, muscles, respiratory, digestive, etc. And the anatomy comes in front of you in the live room, and which, just like how I'm presenting you right now on the Zoom, can be similarly presented to the students as well, with the proper details as well as the audio from an AI audio feedback. If you don't want the AI audio feedback, you can have the professor or the tutor teaching you about each and every part. You can grab each and every part, teach them about the tumors around it, extend it, increase it, and etc. Have it in 3D format, completely check it, right? Now, teaching about the respiratory system specifically, we have bronchioles over there and etc. As we move further there. Now, everything depends upon how the tutor is able to teach the students in that format, right? Rather than just showing a PPT-based one-slided image of a certain anatomy, right? It's better to have a 3D implemented circling it around. Now, in the initial phase, students does not need to wear the headset, but in the later phase, yes, as they go further, they will be able to, get acquainted to the virtual reality, and they'll be themselves able to use it. Dissection, every model can be properly dissected and can be viewed. The internal parts can be viewed. Not just lung model, but each and every small veins or arteries or heart can be properly viewed in the system. Now, here's another thing that we have developed, radiological based. So what we did that, so every if you have a fracture or you want to take an MRI scan or CT scan, you get a film, you get a small film, which you look it into again a 3D, 2D in a 2D format, right? To that, we implemented in our AI platform, and we converted that exact live patient model, DICOM model, into a virtual reality based 3D format. This is a live patient's X-ray model of the chest. You get each and every different views around it. You can be able to see a dissected view as well. here now these this radiological based DICOM file conversion has been tested in few medical colleges, few hospitals actually. But currently we are keeping it on the educational platform, although we are about 100% accuracy in it. The conversion, let's say if you have a small tumor towards your heart or something like that, it gets completely converted. It has 100% accuracy. But again, as the system goes, we try to implement the educational platform first, trying to show the students. If the students or the tutors want to show the students a new patient case that they want to specifically teach the students in a virtual platform, that is how they implement on our platform, and it automatically in just few seconds it brings you out a 3D model in your virtual reality. So our studies for last 2 years, we have been doing these studies of the surgical platform or anatomical platform, radiological platform, and etc. So what studies we have found was looking at a right graph. Uh, we see over here that the current first readiness level of a student during a surgery, his or her first surgery, happens at 20% of the surgery, at 20% of his readiness, which causes to less confidence in OT. Basically, that's the main reason, which causes to casualties, as we are seeing a lot of casualties specifically here in government medical colleges due to lack of transfer of knowledge, right? Whereas using the virtual reality-based training and educational platform from the start to end, we have seen a gradual increase of the first patient, first surgical tryout of a student at 80% of his readiness. We also have a research paper for that as well. And looking to our left graph, what we try to focus on, this is now this left graph specifically on the surgical part. We try to focus on the knowledge of instruments that they want to use. If you're using a laparoscopy or if you're using an open appendectomy, if you have different case, what different tools to use. We have Stryker companies tools and etc. etc. Knowledge of instrument in handling instructions, that how do you handle that tool, is there any button that we need to press properly before you start the surgery, and everything. So, and the flow of operation procedure after first step, what do you do the second step while performing an appendectomy open surgery. You have to reserve the nerve that come between the third and fourth layer, between the external and internal oblique, and such kind of small things have been taken care of, and that way the student get the complete idea right from the start of his journey to becoming a doctor, right? And then yes, completion and accuracy as it goes. Our market presence, yes, Dr. Raghunath Mashelkar has tested our, and we have also worked with him for a short time over there. We are in Krishna Medical College here in Karad, where we are also implementing right now a neurosurgery based simulation in their lab, in their technological lab, and yeah, and as it goes further. But yes, that is about our company, and that is how we intend to also provide the pass-through application, and where you wear the headset, and let's say Dr. Mehta is teaching, and then he'll be able to teach the students properly through Zoom from the start itself, giving them a better idea to it. Yes. So that is the introduction to the company. Thank you for that. Dr. Mehta, I will shift the baton to you.
Thank you for an excellent presentation. Now, before I keep the floor open for question answer, the proprietor of Human Health Circle, Dr. Hema Mehta, may share her few ideas. She has done Master of Public Health. She has done a naturopathy course. She has also done a dietitian course, etc. So, Dr. Hema Mehta can share her views. She is the proprietor of Human Health Circle. I think, okay, she may not be listening probably. So now the floor is open of any question you have or any inputs, you can keep it. I think Devesh is also there. So all of you can start sharing your ideas, suggestions, etc. From 1st July, we are going to start the series of education in anatomy, physiology, biochemistry, and the student will be invited to join within 2 to 3 days, already the platform is ready. So there is nothing like the first batch, second batch. The topic-wise sessions will be started, and student can attend any sessions as per their choice. And because there will be a once a week sessions initially, student can catch up by attending 2 or 3 sessions. Video recording will be made available through the education platform. So floor is open for your input. Pratik bhai, can you start? Someone should start somewhere. Pratik bhai, can you give your input?
So I was going to the presentation. I was just on the context. I was just thinking that the idea is good, and it will be a. We'll face. I mean, you will be facing teething problems, but it will be a good step, sir.
Anyone else?
And anyway, our NMC also talks about bringing in with something like this. So this will be a handhold technique only for them. Skill training we are talking about. This will be a part of it only.
Yeah. So I was always thinking that the when postmortem comes is almost live, is like a live patients, etc.
Yes, sir.
So the traditionally we used to give injection directly to the patient, etc. Instead of that, the mannequin or virtual reality or postmortem, etc. opportunity if we utilize, then the confidence will be great in the students. Anyone
Yes.
else? Kamal Parekh, Tasneem, anyone? It's now your platform to share. Deves is also Deves can also share.
Hey, great presentation so far. So this is going to be very helpful for students and teachers and doctors both, and professors. Uh, What is, how are you gonna, is there any way you are going to do any tests or exams using a virtual education platform? Or how is that gonna improve effectiveness of knowing how much students actually have learned? What is the process of that?
So there will be series of automated testing will be there, but we give emphasis on while the student is doing some procedure, a teacher should be observing that, and whatever may be the AI, etc., etc. But person to person contact and person to person teaching we can't replace. So once the student is confidence can offer that now I may be observed by the faculty. So that the point will be there, because if we just educate but we don't evaluate, then it won't be a right thing to do. Anyone else? Any question?
So you are saying that when you will be teaching, it will almost be gamified, like you will be asking for small questions during the lectures and sessions itself as well, where students will have to provide input to move forward.
Yeah, there's a quick Google small form itself in the chat, or maybe at the end or in between, to just divert to keep the students in the focus so that they don't divert either or there. Because now students are so much diverted, no? When they are seeing in the mobile, naturally they will be looking this teacher says on the mobile. Again, there's something comes up. So if you keep them in the center, the through frequent question, interaction, etc., it will be more lively.
Understood.
And then input from Chaitanya, Kamal Parekh, Hitesh, Damanjit, all rest of the people can also give input, because few people who are watching through the YouTube may not be able to interact, but those who have joined the Zoom have the privilege to interact. So, Dr. Tasneem should at least spell out something before we close with a few remarks. So I think, yeah, please.
Sir, this will be good for the students, but what is the benefit to the doctors?
Yeah.
I mean, who are already doing some practice or something.
So the doctors means practicing doctors and faculties who are teaching. So in this case, our faculty would include the general practitioner, the specialist who is practicing. Our students can also become as a faculty. And once we decide the fee structure, what we are going to charge to the students, some of the part will be given to the motivators and some of the part to the faculties and other admin costs also. So the exact benefit we cannot say as far as remuneration, but faculty will have leverage to see our rest of the courses also. Say, for example, someone is taking a lecture on ENT, but that faculty we are going to give access to all the subject of the relevant things. So that will be the great thing. And other things, the practicing doctors will have the live connection with the academics and research. So when they have some failure in the day-to-day life, they'll be able to get a fresh knowledge from this our education platform. Right now, suppose the practitioner is having some joint pain, series of joint pain cases is puffered. Instead of keeping the on the eyes on the medical representative who is hardly having a much knowledge except his or her own the company. So this kind of the benefit will attract so many practitioners also.
So one
Any
example
other?
I would like to give, if shall I continue?
Yeah.
Yeah. So one example I would like to give you, a year ago when we had implemented one of the medical colleges where the virtual reality platform, it was specifically implemented in their technical lab and not given to the doctors. But what happened later was it was so easy to carry, as in the remote learning that we are trying to implement here, right? Our main goal is to have a remote, immersive and remote learning where students even far away from you are able to learn properly whatever you're trying to teach. So in that case, what happened was the doctors were able to carry our system anywhere they want to. If they don't want to, first of all, go to hospital or the medical college today, they taught from their home or wherever they are. And secondly, they also were able to take a remote guest lecture learning in a different medical college where they were called out from the place where they are. That's how the remote learning should work, and it should not just work in just a simple Zoom call, but it should work on a very immersive field and giving them a understanding of each and every part of it. Now, such kind of simulations are also shown. The doctors show it to the patients. Not only are they using it even in their professional field, but also they are showing it to the patients that what exactly surgery in a very basic format they are going to do. Patients sometimes they feel afraid that, hey, we are very afraid to have this surgery, what are you exactly going to do? So in a very basic format also they try to show it to them. Well, this is not the educational learning, but the teachings that it gives is what it will help the doctors as well.
Yeah, we are fortunate to have Dr. Reenu Sharma over here, professor in biochemistry, and she has contributed a lot for the foundation of this virtual learning. And I would wish that she can also contribute her some of the thoughts. Dr. Reenu Sharma. Or someone,
Hello.
yeah, Reenu Sharma, please, yeah,
Good afternoon, sir.
please carry on. Yeah.
Yes, sir. I have actually talked to you, and this is a good platform. And we can guide the students also, and they can be much in touch with us easily and comfortably than in the college they feel. But, sir, the problem is like the way we have to make our lectures and all, like simulations and all, animations, that has to be will be required from a computer person, like to make
Yeah.
them more effective.
We'll have that sessions for training for our faculties. Actually, the Ashish ji and Devin came to Swaminarayan Medical College,
Yes,
and
sir.
they gave an excellent the practical demonstration. Yeah.
Okay.
Yeah.
So
So
anyone
not only,
else?
so what we are implementing, let's say you have anatomical learning. Let's say you have the anatomy syllabus, you have from chapter 1 to chapter 10 or any other chapters you have, right? So the syllabus, the animations or the applications are made in such a way that they go each chapter basis. So you will have much more easier freedom and easier way to teach the students rather than, just jumbling the words around here and there. So the animations and the models are all will all be taken care from prior itself as syllabus based rather than any just random. If you go online, if you check for any 3D model of anatomy, you get the complete anatomy of a human, but then you have to specifically teach the students a particular part of it which you can't focus on. Whereas we try to focus only on those parts as the syllabus. Hope this solves the question.
Jigar, you want to spell out something? You wanted to say something? Anyone? So before we close the thing, anyone who wants to contribute? So we'll communicate this link also so that you can go through it. From 1st July, we are starting anatomy, physiology, biochemistry sessions. The teachers teams will be prepared and gradually will be driving towards an ideal virtual medical education. All of you are free to contribute at any point of time. And we have a special group, Virtual Medical Education. If you are not part of it, we'll give you the invite link, and you can, for the communication purpose, you can write my contact number 9428503295. I will write in the chat box so that you can write. Dr. Rajesh Mehta, I have a 44 years experience in community health and more than 30 years in medical education. I have been part of more than 100 inspections, NCA and NMC, postgraduate, undergraduate, etc. And right now I am concentrating my energy on virtual medical education. And physically, right now I'm not connected with any medical college, but in this virtual medical college, I'm connecting with so many medical colleges all over the nation. So thank you all, and I end the meeting over here. Thank you.
Thank you, sir.
Thank you.